9:13, welcome back into Live at 9 this Tuesday. At the beginning of the year, it looked like the coronavirus might be going away as millions started to get vaccinated.
But as states started to loosen restrictions, the virus began to surge to new heights, raising questions about government policy and its impact on your life. Ron Schultes from Tennessee's Beacon Center is one of the researchers combing the data for answers, and what he found out may surprise you. Ron, thank you for joining us this morning on Live at 9. First and foremost, tell us a little bit about your work and the research.
Absolutely. Thank you for having me. What we wanted to look at was, were states able to protect both lives and livelihoods? We've all heard the term that states are the laboratories of democracy, and all of our states across the country were essentially having to deal with the same problem at the same time as a result of the pandemic. So it created an interesting opportunity. And so what we wanted to see was, like I said, could we both protect lives and livelihoods? And so what we did is we looked at 4 states: Tennessee, Kentucky, Georgia, and Michigan. 2 that opened up sooner and had fewer restrictions, economic restrictions, compared to 2 that had more stringent restrictions. And what we found was that Tennessee and Georgia were able to save thousands of jobs, have much higher labor force participation rate, all while showing no statistical evidence that reopening sooner led to an increase in cases. And so what we've seen is what we saw from last year's data was that the broader base restrictions that other states tried to implement were ineffective, and then also had dramatic consequences on the economic side.
Mr. Schultes, we're now at a new phase of the pandemic, dealing with a more contagious and deadly Delta variant. And as we speak, there's lots of change happening right now. Some of the 2 of the states that you mentioned on the opposite side of the spectrum both have higher vaccination rates than Tennessee and Georgia. As we approach this new phase, how do you balance that? Because you have some restaurateurs saying, wait a minute, I want people to come back and eat in here. I want people to be able to come back to work, but not without a vaccination.
No, that's a great question. I think we've seen clearly that the vaccine is the #1 defense we have. But I think what this shows, what we were able to see, is that anything that is broad-based is going to be ineffective. Certainly, there were reasons to implement limited and targeted measures last year. And as we're seeing a 3rd or 4th wave, depending upon who you ask, as a result of the new increase in the Delta variant cases, any public policy decision that our leaders look at, what we should learn from is from the lessons of last year, and make sure that we're using targeted and specific measures to minimize the consequences on the other side of the spectrum with things like livelihoods, mental health, etc.
And also when it comes to vaccination rates, especially in states like obviously Tennessee, Mississippi, and Arkansas, some of the lowest vaccination rates, as you know, in the entire country. Locally, did your research indicate what can be done to improve those vaccination rates? Did you delve into that?
We didn't. We wanted to look at, for example, the state level data around jobs, labor force. For example, what we saw was in Kentucky and Michigan, 4 times as many people quit trying to find a job in 2020 as compared to Tennessee and Georgia, due to partly the higher restrictions, so it made it where it wasn't even worth trying to find a job, and also, for example, their higher unemployment compensation. So, for example, if we had had the same drop in the labor force rate, it would have been almost 10,000 Tennesseans that would have essentially not been able not just find a job, but give up even trying to look because they were so discouraged. And so what we wanted to see was those other types of consequences. And I think what our study showed is that all public policies matter. And so while we certainly need to, in a pandemic, make sure we're protecting the public health, there are other consequences that our policymakers need to at least keep in mind as we make decisions going forward.
If people at this point still, though, fear for their health and safety, given where we are at this phase of the virus, we're at a point where Tennessee, Dr. Piercy just said, was it yesterday, that we're looking at having to call in National Guard to help out because of the hospital system situation. We know 1/4 of the cases here in Shelby County and many across the state are pediatric cases, so we're at a different place. But if people are worried, concerned about their health and safety, how do they still go out and support? How do they, and I know the research was done at a different time, but there's still a balancing act there.
Absolutely, and that's what we talked about. It's like walking a tightrope that our policymakers are trying to balance, right? There's a lot of different things at the table. One of the things that we talked about was one of the reasons why we have this concern about ICU beds and hospital capacity is because of government regulations. For example, certificate of need laws that mandate that the government gets involved into any increase in hospital beds. So some of the things that we can be talking about in order to create that capacity, in order to make sure that our system is able to handle this new influx in cases, is getting sometimes government out of the way and decreasing regulations. So that way hospitals can increase beds, as needed.
But some might argue at the same time, does government maybe perhaps need to be in the way to enforce maybe vaccination efforts right here in Shelby County? To give you an idea, those 17 and younger, we're seeing more younger people now getting COVID-19. How do you argue that?
Well, the first thing I would say is if the government has to get rid of any health regulation in order to fight a pandemic, then what's purpose did it serve, right? So that's what we saw, for example, a lot in 2020 was Governor Lee waiving a lot of restrictions on healthcare facilities. Like I said, we used to have a government limit on how many hospital beds we have. I'm sure if we didn't have that regulation on the books for many years, we would be in a better position than we are now. So I think one of the easiest things to first look at is, for example, is finding the ways that our government and state laws that are on the books, while they may have been well-intentioned, actually have hampered our efforts in order to fight this pandemic. So I think that's the first place that we should be looking at.
All right, Ron Schultes from Tennessee's Beacon Center, thank you very much for giving us your perspective this morning. We do appreciate it as the debate about the government's role, especially dealing with this pandemic and the coronavirus, continues.